American Dental Association and the American Academy of Pediatric Dentistry has produced some excellent resources on silver diamine fluoride, and I'll encourage you to look at it. These websites to get more information on silver diamine fluoride use. And we're now going to play a video which is actually from the American Dental Association site, and it shows how to use silver diamine fluoride. So let's have that video played.
Once SDF application is agreed upon, it's important to follow the proper 4-step process. Step 1. Carefully set up your workstation. Clinician and patient should protect their eyes, and only a drop or two of SDF solution is needed for treatment. Step 2. Check the cavitated lesion for food residue or gross plaque. If present, remove it with a microbrush or cotton pellet till exposed dentin is visible. Dry the site of the lesion by patting down the area with gauze or cotton. Step 3. With the site now clean and dry, brush SDF onto the exposed dentin. Move the tongue and lips as necessary and use careful strokes. If needed, remove excess solution with gauze. Step 4. Allow SDF to dry on the lesion for 1 minute if possible, making sure that the lesion site does not come in contact with the gums, tongue, or lips. As the SDF dries, you will likely see the lesion darken. The patient should be monitored short-term, and reapplication of SDF should occur within 6 months to a year. Treatment can be concluded when the treatment surface is hard upon probing. This indicates that the lesion is arrested and not progressing. Let's review the key takeaways. Practice informed consent. Prior to SDF application, explain potential side effects such as the blackening of tooth surfaces treated with SDF. Ensure that patients and their caregivers are aware of all non-restorative and restorative treatment options available. Minimize future caries risk. Talk with patients about how home care, such as routine brushing with fluoride toothpaste and interdental cleaning, can help minimize the need for future treatment. Follow up. After initial SDF application, carious lesions should be retreated with SDF every 6 months or annually. Patients should be monitored periodically throughout the course of treatment so that changes in lesion hardness, texture, and color can be observed. Lesion hardness is the definitive outcome, and hardness upon probing should be clearly observed.
Well, it decreases dentine hypersensitivity, it arrests lesions, it prevents lesions, it kills pathological organisms, and it also remineralizes softened dentine. So it does a number of things. There's a number of things that it can and cannot do. There is substantial evidence that the removal of all infected dentine in deep caries lesions is not required for successful caries treatment. Incomplete or partial caries removal. So we're not removing all of the decay. Then we're applying silver agent, either silver diamine fluoride or silver fluoride, and then we are applying glass ionomer. Works really well. 2021, the World Health Organization added silver diamine fluoride and glass ionomer to its essential medicines for adults and children. So these materials have been recommended by the World Health Organization for the prevention and the treatment of caries.